Hello, ladies and gentlemen, my fellow Africans, and especially my fellow youth. It's a beautiful morning. You are most welcome to MJD Build Africa podcast. We are so delighted to host our brother, Your Excellency. You are most welcome to MJD.
Thank you.
Thank you so
much.
How are you doing?
I'm good.
Yes,
Very good.
thank you. You are so smart in African shirts.
Black, yellow, red.
So that is the Ugandan flag. Thank you, a patriot guy. You are most welcome to MJD. Feel free.
Thank you.
Yes, long time.
Pushing.
It has been a while. I last saw you we met in certain symposium, but it is almost 5 months. So how is it going outside here?
We are pushing. We're just pushing.
Yeah, thank you. So, Your Excellency, our followers would love to know who you are.
Thank you so much,
Yes.
Dominic. To all the followers of MJD, thank you for always being in. My name is Brian Aruho. I was former guild president, Cavendish. It's 15 to be exact. I was a student of law, but now I'm a lawyer. I major in international health and energy law, but I think the main reason as why I'm here is because I head the Aruho Foundation, and we work on the same things that you're doing, diplomacy, governance, but mainly culture.
Mainly culture. So you said that you served as 15th guild president at which university?
Cavendish University.
Cavendish University, where the success begins from.
The only university.
So now you are the successful guy?
Pushing.
Actually, Cavendish University is one of the universities that have good products around here in the field, such as Chameleon, such as
Bobby Wine.
Bob Wine.
Yeah.
That's great. Then the third one is Aruho.
Obviously.
Yes, Aruho. You said that you are the founder of Aruho Foundation.
Yes.
Can you tell us briefly about Aruho Foundation? But before you go to Aruho Foundation, you said that you served as the guild president at the Cavendish University. Can you tell us briefly about your leadership at Cavendish? Did you start leadership from Cavendish or before so you have been serving as a leader?
Now, my story is funny. I contested in primary, Muganya Preparatory School.
In the primary?
Yes. P5 to be exact.
So it started a long time ago.
It was not a good journey. Because I contested in P5. I got 2 votes.
2 votes.
Me and
you and your girlfriend.
No, me and my friend. It was a single-sex school.
It was you and your girlfriend.
Me and my friend, it was a single-sex school. Muganya
Yes, it
Preparatory
was single school. In
Kaboja.
primary?
P5.
Yes.
I got 2 votes. I left anything
In
regarding
concern
contest,
politics.
but would push people, but wouldn't contest.
Yes.
Obviously, when I went to Ontario, I left. I contested again in S5. I
Yes.
was at Bugema Adventist Secondary School, Gayaza.
Yes.
So I contested again as someone who was an OB of the school and had cousins in nearly every class.
Yes.
It was a tough
And
fight,
exes.
but I don't know. But we beat him.
How did you manage
I
that?
don't know.
role?
People liked me. We beat him. Then I came to Cavendish. 2021.
Yes.
I happened to campaign for someone who passed through. Passing through, he appointed me as Minister for Public Relations.
Yes.
Then that was year 1, semester 1. So it pushed me, because it's a year tenure.
Yes.
Pushed me to year 2. In year 2, I contested again as someone who was in year 3
Yes.
for speakership of the Cavendish Law School.
Yes.
We beat him. So I became speaker.
So you served as speaker there?
Yes. But of the law school, not guild.
Yes, as a law school. Okay.
So from that took me to year 3. Then
Yes.
in year 3 I contested for guild, and then so
It was sure deal.
it was not a sure deal. We voted twice actually because of irregularities here and there. But then
It was
also
a
the
range of
pressure.
votes.
Something, but more of pressure and students
I was told the votes.
hostility. Something.
Oh, you
I
did
can't
like
call it
what
voting.
happened last time? Last time, His Excellency Muzei said that Bob Wine Yamubakaruru.
I don't consider that stealing, but there was hostility. They are in the 2 camps because we all had equally enough pressure.
Yes.
But later on, we won either way. At the end of the day, we won.
Thank you. Congratulations.
Thank you.
Then Before we proceed, I would like to ask you, as a land fellow, because you are no longer the learning fellow, you are the land fellow now, a senior counsel. So as a lawyer now, but who passed through that struggle of academic, now which challenges did you face as a leader at Cavendish, and how did you overcome those challenges? You know, when you are a leader, you receive many cases from students complaining. How did you help them to overcome the challenges, and which challenge did they face in your regime as students?
Okay, I think by and large, the challenges are more or less the same in every university. We have a challenge of unhealthy competition. Now, in the way that it's normally not even academic, it's lifestyle related. So I see Dominic has this phone. Brian has this phone. Now, Dominic is from a well-to-do family.
Yes.
I'm from a humble background. But
Your Excellence, former president, retired but not tired.
I'm not tired.
Yes. Now, as someone who served as a president of university, you know the challenges. You received many complaints in your offices of students that they are facing at Cavendish University. So, which methods or strategy did you use to overcome those challenges in students? Yes.
I think the methods, one, it's more of knowing your electorate. Most of the students were my friends. They had my number. So handling issues becomes easy because Dominic will call you and say, oh, Aruho, A, B, C, and D has happened. How do we handle? You don't have to have a whole meeting and you direct them, tell them, no, go to this person, go to this person, they will handle you. Then you call the person and tell them, oh, person A, B, C, and D is coming. Maybe it's because of registration.
Yes.
And instead of them rotating, and the issue is that Cavendish is largely a University of International Students.
Yes.
So the main issue is language barrier. So, excuse me.
It is okay.
If a Somali student is trying to explain to a Ugandan, you need to be very patient. Now that's why they say you should be a leader who's patient. Be willing to listen. Yes, they will call you in a 10-minute talk. They're talking about something that they would have completed in a minute.
Yes.
But you just have to listen. So I think by and large what helped us is that we were friendly. We were a friendly cabinet.
Yes.
Because my vice president was the person I competed with.
Yes.
Was called Duan Kinube, a Congolese student.
So he made you shake hands.
Yes, he was my vice president. After the whole electoral saga, we said, why don't we work?
Life should continue after election.
So we brought him in, he became vice president. So he handled those students that used to support him.
Yes.
So they didn't have necessarily come to Brian. No. If you have met him, you have met me. Because we sat and realigned. So it's, I think, by and large, it's me knowing what brought me in office, how long I'm in office, you plan, then say, let me serve students well. It's by and large that.
But which other challenge did you face? Did you face students where they complain about their marks, about any other things concerning their hostels, their life at campus, how their embarrassment, such kind? Did you face such challenges, and how did you overcome them, if you faced them?
More of the challenges we faced were lifestyle challenges.
Yes.
People wanting to equate themselves on something that you have not reached. Dominic has an iPhone, maybe 16 Pro Max.
Now you have 17.
17 Pro Max.
Yes.
Yeah? Now Brian has an iPhone X. But you want to equate yourself with Dominic. You do not know where Dominic's parents work or what investments he's in. So you find, I want to steal to afford.
Yes.
Or I want to fake to afford. So you find at the end of the day, people are suffering with stress.
Yes.
Mental related. And you're like, what's the problem? Oh, you see. But that's not what brought you. What brought you is academic. Tell me an issue that maybe my portal has refused to work. Then we handle it. Then the other thing I think as university students, the main issue I think that also came in after lifestyle is the issue of relationships. So you find someone trying to balance studies, a hard course,
and a relationship,
and then a relationship that is not even taking them anywhere. So a person calls you and says, like, hey, Brian, there is this girl, and you're like, A, B, C, and D. Like, but you, man. So how is a relationship connected to campus? If the person is stressing you, leave them, because at the end of the day, what your parents want to see is a good CGPA.
Not a good, beautiful.
Not a big bummed woman or what.
But also matters.
That also
Better
matters.
preparation, yeah?
Yes. But you see, what took you, what is key to you joining university was not getting a woman.
It's a degree.
It's the degree. That is why your parents were praying for you when you're in A level. Oh, we pray that our child starts from a degree, not from a diploma, not from a certificate.
Yes.
That's why they were praying for you to go to that university. Even you. That's why when they told you which course you want, you said, I want this specific course. So you didn't go. You've done primary, you have done A level, you've gotten the points to do, let's say, for example, the law course. You've reached first year, you're sort of mentally stable, you're performing. Then second year, some girl comes and confides you, or some boy. But that's not what brought you. Because now, if you get a past degree, who's going to employ you? Leave alone that. Credibility goes. Because we shall say, but this guy is unserious. 4 years and you've got a past degree. So what brought you mainly is academic. Yes, these other things are temporary. Even being guild president, it's not what took me to campus. It is something that found you. So I think university students in Uganda, especially in these universities, Cavendish, KIU, Victoria, IUEA, and Clark, I think, and Makerere, largely, the issue that we face is we do not know the difference between needs and wants.
The difference between needs and
then wants. We want to do everything.
You differentiate them.
Let me differentiate them. I need to get a degree.
Yes.
I don't want the degree. I need to get it. Yes, I want a phone, but I need the degree. I cannot need a phone over wanting a degree. No. So what is priority? Yes, you have to prioritize. What is my priority this semester? I want to become guild president. That means I'm going to campaign heavily. That means I'm going to have a team. But accordingly, I also need marks.
Yes.
So now that is a need. Because your parents are going to ask you, yes, Dominic, what is this? Yes, you've become guild president. But you have a CGPA of like 2.8.
We didn't send you to be a guild president.
We didn't send you to be a guild
You
president.
did not go in politics. You went
No, that's why you see most of them later on when they fail. And now you see the problem with this is that you know the cobweb network.
Yes.
When you now fail and then you've sort of been in student leadership, now quickly your mind resorts to,
yes,
let me go to constituents and I run. Because you
failed. Yes.
So then, anyway, that's a story for another day.
Those are the challenges that
which
you
transcended now
faced
into, yes,
in your office as a guild president. Now, Your Excellency Aruho, we all know that you have a foundation called Aruho Foundation. Can you tell us briefly about Aruho Foundation? What is Aruho Foundation and what is the vision and mission and where shall we benefit from Aruho Foundation as young Ugandans and Africans at large?
Thank you. We started the Aruho Foundation towards the end of 2023.
Yes.
But we mainly started work in 2024. Now, mainly we handle three aspects: diplomacy, governance, and culture.
Diplomacy, governance,
and culture.
And culture.
With diplomacy, we look at the whole aspect of international relations,
yes,
diplomatic relations, as well as consular relations. Mainly those three
yes,
areas. Now, governance would handle what the normal Ugandan would call politics. And overseeing, but we don't go deep. Now, we handle more of leadership. Not politics. We handle more of leadership, governance, that aspect of equitable leadership. We don't want to drill more into politics because it is more of a double-edged sword. We want something that is clean. Now, with culture, we are looking more at culture preservation.
Yes.
Because the belief has been, and if you've listened to the president saying that we've had a big cultural erosion. Yes, we are educated young people, but culturally we do not know. We do not know our clans. We do not know our totems,
norms and values.
And values. So you find there are some examples I wouldn't use, but you would find someone says I'm from Tungamo district, and that's where they can end. Does not know. Even greeting, they would say the basics or the rota, and they cannot engage in a 5-minute discussion.
Yes.
So it's not something about just Western Uganda, really. It's a general perspective. Though we are trying to patch up some works, but one start from Western, then we go cutting, then we end with Central. But the overall idea is we try to make an umbrella association that can look at now university students going down. Then later on, when the plans come into effect, we can then have those national symposiums, maybe something running for a week,
Yes.
but on an annual basis.
Yes. Then you talked on culture. Aruho, how will you convince these young people who prefer colonial language and Western culture to come back in our ancestors, in our culture? And secondly, does Aruho Foundation have boundaries? Is it only for Ugandans, or it may continue and reach maybe to other countries of Africa? Because you said that it is aligned with culture. If it is aligned with culture, on my view as Pan-Africanist, I think it should also maybe reach to every country, like to our countries of Africa. So
now, in line to that, one, let me first begin with why the first question you asked.
yes,
You see, me, I'm from Ntungam,
Yes.
Kajara specifically.
the way you love it.
Yeah,
I always
I love
see
it.
your post everywhere.
Oh, wait in Ntungam.
Hey,
I
when
love that
Ntungam.
slogan. Why? It's because at the end of the day, when you die, you're not going to be buried in Kampala. So if that cannot make you wake up, so what's the purpose of having multiple investments in Kampala and yet at home you have a grass-thatched house? Where will they bury you? Because people are going to drive and come to bury you.
In your village.
Because in Kampala they know you are a big person and only to reach to trash. Yes, you are not born there, you didn't grow up there, but that is your home place. Secondly, if death does not scare you, that is fine. We have okuhinjira.
Yeah,
those
weddings,
things.
introductions.
Are you going to use English on okuhinjira ceremony?
Actually, last time I saw Museveni was in our village. He used during Yankore.
You
When he was
cannot.
introducing.
If you're Mufumbira, if you're Mnyaranda, in the Bukwa, you're going to use your language. If you're Gusaba. If you're Muganda, what is it called?
Okwanjula.
Okwanjula. You have to use Luganda. You're going to use English because you're educated.
Oh, no
That is-
Okwanjula mu Luganda.
When they say Tambulango Muganda,
Eh.
are you going to say it in English? No. Let's say later on you want to contest. You're going to go to the village and contest in English.
Which is impossible.
It is impossible. So at the end of the day, whether you want it or not, you need to know your language, because when you know your language, you get to know your identity. Now, when you know your identity, you get to know the taboos, the norms, the principles that either your tribe stands for.
What you call mila na destiny in Swahili.
Inside. So like me, I know you can never find me with dreadlocks on my head. No.
Why?
Because I'll tell you,
My culture.
President Museveni says he comes from Ntungamo district. If I've never seen our president with dreadlocks, you will never see me with dreadlocks.
Yes.
My father comes from Ntungamo. I've never seen him take alcohol. You will never find me take alcohol.
It's not in your culture.
May not necessarily be that people drink. But you see, when you get an identity, my dad doesn't do this, then how do you do it? There are some cultures that do not eat fish. Then for you wake up one day, you come and eat fish. And people come to pay a visit. What are you going to feed them on fish?
Na yebinyanja.
So you see, so it isn't about only the Western culture, it's about knowing your identity.
Yes.
So whether you go to Rwanda, whether you go to Burundi, Nigeria, people have principles.
Yeah, thank you, Aruho Foundation, the owner,
Chairperson.
CEO, chairperson.
We have a bigger board.
Actually, I love the ambition. That's what we were discussing before. In Africa, I would wish to see other African youth who are very ambitious be there in creativity. Then Aruho, as the former guild president, how do you think that students' politics or campus politics can shape the future of Uganda? These politics that we play at campus.
This one.
Yes. How can it shape the future of Uganda, East African community, and Africa at large?
If we were really interested, and this is my personal view,
Yes.
if we're really interested, it would graduate from the aspect of politics, then we go to the aspect of leadership, if
Yes.
we were interested.
Yes.
Because at politics, we want the chairs. We want the names, want to be called honorable, want to be called speaker, right honorable, president. So we can do anything that to reach there.
Yes.
But once you get it, I think now you need to realign your brain.
Yes.
So how can students come into this? Is knowing that university is different from real life simulation. But when now you come and say, I want to contest in the constituency, let it not be a do or die. The problem is that most of your student leaders, our student leaders in Uganda,
Yes.
look at political positions as career. I need to be this. But it's not a do or die. But if it means slander, if it means they will do that to get that is now political careerism.
Yes.
So if we can only look at the aspect of, yes, I was a guild president, but I believe also in the legal career I can contribute much. If I ever come to contest, yes, I will. But it is not an immediate thing, because now you've gone into politics. How sustainable is that? I've become an MP at 26. Will I be voted the next time? What about the third term, the fourth term? Will I be? Then you'll even still be too young, and people are saying, this guy has overruled us. But how do we transcend into that? Is one having a circle that guides you well. Most of my life and my leadership, I've accepted guidance. People tell you, do not contest, you're still young. Yes, they may sort of suppress you, but you try to look at their calculation. But you see us, we don't want to be advised. No, I can do it if they did it.
What about me?
What about me? And you guys have been long in office. I want to come in office. But how sustainable is it? You're going to get loans. Who's going to pay them back? Or, okay, let's say you've gotten the position. First, we're going to be happy because mine is to congratulate. But at the end of the day, at what cost? Mentally, physically, spiritually. That is it, really.
Thank you, Mr. Aruho. Then I want us to talk on Uganda National Health Care Insurance. You see that in Uganda, people are suffering in the health insurance, and people are dying in hospital because of insurance. So doctors fail to treat someone because he doesn't have insurance. So how do you think it can be improved to better serve our population? Yes. And what do you know, in first hand, what do you know about healthcare insurance?
Now, I specialize more in health law. When I was doing my research for graduation,
Yes.
my dissertation was around the impact of donor funding.
Impact of?
Donor funding.
Yes.
On the realization of the right to health in Uganda. Now, usually, every country, you would say, has 3 modes of health financing.
Yes.
That is government financing. You have OOP, that is out of pocket financing, stroke privatization.
Yes.
And then you have donor financing. Ordinarily, that is the order that is supposed to follow. Now, sadly for us, it is the other way around. We have donor funding first, we have OOP, then we have government.
Yes.
Now, that cuts across to how you get healthcare, quality and amount. Why? Is because when donors bring money, you're not going to regulate them on how much money they should put in a certain hospital.
Yes.
No, you can't. It's like saying USAID has come and then you're telling them, no, we only want 10 billion.
Yes.
No, it can't happen. They are working on what NGOs or civil society organizations have brought as per paperwork, budgets that have been approved. Now, I'll tell you why that becomes very dramatic. A number of years back, we used to have a good partnership.
Yes.
But then we got that Gavi scandal. When donors pulled out, there were just few months, we felt the impact. Why? We didn't even have a national health insurance as a country.
As Uganda?
Yes, we don't. We have a bill, but we don't have an act. Now, where that affected us is that, the people in Kampala do not suffer a lot. People in metropolitan areas do not suffer a lot. Why? It's because they have money here and there. They can make a deal. The main person who suffers is the person up country. Because you do not know, can they even afford the medicine? You're saying in Canada is at 1,500 Uganda shillings. But are you sure everyone can afford that one tablet? Or maybe that strip, can they? Now, if you want to know how deep this goes, you look at COVID. When the COVID-19 break came in,
this pandemic.
Now we are locked in our houses. Those that had money ran up country.
Yes.
In running up country, they even told their children, do not overmix with these locals, you might get COVID. But it's not that they were fearing COVID. They were fearing that that health center next to their home may not be at the level to treat their children.
Yes.
But they wanted to treat other people.
So that's the reason why they ran away.
They ran away. So even when they took them up country, they would tell them, you play from around here. Visit this home, don't over.
Yes.
Because they feared, should my child get COVID, I might have to run back to Kampala. Now, the National Health Insurance Bill was brought in a way to leverage. With that, in case we had it as an act, would then be knowing that on a bill, on a certain payment, Dominic is only going to pay like 3% of it.
Yes.
The rest is going to be covered for maybe by government or key players.
Yes.
So, yes, I'm going to pay money, but it is not that painful. Now, if you look at Rwanda, if you look at Ghana, they have tried to control that.
Yes.
That yes, you're going to pay. Yes, you're going to go to hospital, Dominic, and pay money. But you're not going to pay the full amount. You're only going to pay a certain percentage. Now, why we are saying we need a national health insurance bill, why we actually need it as an act, is because you see, Dominic, today you can be alive. We move out of this podcast and you're knocked. You will not die.
Yes.
You will just be knocked.
Injured.
You rush to hospital. And honestly, you do not have the money for that treatment. Even if your family comes together and says, hey, that's why you see in Uganda, continuously we have, please donate, please donate, please donate. We are saving a child, we are saving Mary, we are saving Arho, let's save. It's not because we like contributing, no, it's because we know things are tight. Dr. Basaja Balava recently, Honorable Basaja Balava recently lost his mother. This is a very wealthy individual. But if you're to hear the speech he gave on the mom's burial, it was more on health insurance. This is a rich man crying about prices. Then what about you? You who is earning,
man.
You who's earning 100,000. When they are saying annually, you are among the people they count on annual basis.
Yes.
This one is not doing well off. Can you afford? I'll give you a case scenario. Aroho Brian has a wife, has 6 children.
Yes.
I cannot program for sickness that for you get sick today, then done after 1 year.
Yes.
My wife today might be pregnant. I might get knocked today. Then tomorrow we are coming out of that saga. My son gets diarrhea, and the next day gets headache. I have to cover all these costs. But what's the return on investment? I'll give you another scenario. We have patients usually going to dialysis. Now, it's common knowledge that usually when your patient goes into dialysis, it is very rare for them to come out alive.
Yes.
Whether you treat for 2 or 3 years, they may end up dying. God forbid.
That may happen.
But they happen. Even doctors know, even you know that if they tell you your relative has gone in ICU, you get second thoughts. Your relative has been put on oxygen. You start saying, You know the truth. But you know what you fear most is not the person dying, is the loan after.
Yes, after paying, after treating
person,
him.
Yes. How do you start now? You have to pay debts, which you're not. So we need the national health insurance, and I do not know why policymakers are not taking it up. Because you see, when you go to Rwanda, I'll make a very case scenario to Rwanda because it is just below, it is next to us. This is a neighboring country.
And a very new country.
New in this dynamics, but their national health insurance scheme is
very stable.
Look at Ghana. Their national health insurance. Look at Thailand. Okay, outside Africa, look at Thailand. They have built such a system. It is one to be proud of because you see, Dominic, yes, we might have good roads, we might have water, we might have electricity, but health is
so
key.
Crucial.
It is very key to the extent that you see Jomo Kenyatta, I do not know, Uhuru Kenyatta, His Excellency, I do not know if it's true or wrong. He went to their own hospital for treatment.
Kenyatta Hospital.
But here we had the Honorable Dr. Chris Bariomus.
Yes.
He was deep in his constituency. When he got an issue, they had to airlift him. Not take him to the nearest health center. But you want other Ugandans to be taken to that health center.
And yet for you cannot go there.
For you want to be flown.
Yes.
To be airlifted.
Yes.
And be brought back to Kampala.
But the citizen of Ugandans.
The one who
But then
puts
the
you.
village, yes.
The one who you come after 5 years and then you give a bowl of soap.
Yes.
You want them to. So at the end of the day, is it viable? No. So that is it.
So how is national insurance, healthcare, help a peasant person, a local person who is deep in the village in Tungamo, in Rushenyi, in Ruhama. So I want you to make them understand how it's crucial to pay that insurance and how they can get those insurance.
Now, I think one, me, I would really urge government to, if they can talk to the president and he assents
Yes.
and it becomes an act, how does it help someone? Let's say in Ntungamo, to be specific. It's that they are not going to suffer a lot with paying bills. But not the full amount. They are going to pay what they can pay sustainably. You understand? So instead of them getting a bill of maybe 50,000 Uganda shillings, they are going to get a bill of 20,000. Why? The 30% might have been already catered for.
Yes.
Now, the thing with, if you look at the National Health Insurance Act, the Health Insurance Act of Ghana,
Yes.
is that it gives a percentage. We are not trying to make everyone poor. We are just saying that if you're a little bit richer, or if you are a civil servant, or if you are employed, let's cut off some money.
Yes.
We put it in our reserve.
Yes.
So that those ones who are a little bit poorer than you,
Yes.
more humble than you, can get some
Can
money
utilize
for treatment.
Yes.
Because for you can get a deal. Because for you have a job that is paying you. But this person, you do not know that we might be in a banana season. But wilt may come and take the whole plantation.
Yes.
And this person only survives on matoke. Matoke, which they are also going to sell a bunch very cheaply.
Yes.
Because it's the village. So we are saying, try to look at this other angle. Someone might be from Zimbabwe, someone may just try to look at. But you know it when you go in December.
Yes.
Even you feel ashamed and say, let me give them 5,000. And you see them happy.
For that 5.
That 5,000 is a lot. 2,000. If you give them 1,000 for warrant.
Cultivated since day one.
If you give them 1,000 for warrant, they be very happy. It's not that. No, it is. They are happy because this is money that has just come, which they have not worked for.
No.
So how does it help is that you reduce on the bills you're paying, especially medical.
Thank you, Arho. Then my other question concerns that, how can Uganda government learn or copy from other countries who tried their best in making healthcare insurance stable, such as you have mentioned Rwanda and Ghana in Africa. So what can Uganda copy from Ghana or Rwanda or other countries in healthcare insurance?
You see, now the problem is that we think we are too perfect.
Sorry?
We think we are too perfect. We can copy from Ghana, but telling them to go and copy from Rwanda, as if maybe something wrong has happened. We need to learn from Rwanda because they have done what we've not done, especially in healthcare.
Yes.
So I think what would be prudent is Minister of Health, the top officials,
Yes.
sitting down with the president, and policymakers, because I know Parliament should be having a health committee, sitting down with the president and explain to him that we really need the National Health Act passed. From a bill to an act. Then, at that stage that we have the act,
Yes.
we know we have the act now. Yeah? We then do a benchmark. Or even the president can say, first benchmark with Rwanda.
And see.
How long did it take them to stabilize in regards to healthcare insurance? How are they doing it? How are they charging? How long does it take? And what frameworks do they follow? If you feel dissatisfied, fly and go to Ghana, or have another team go to Ghana for purposes of Africa and see how Ghana is also handling the national health insurance. If we still feel that it's not enough, there is Thailand. I think Thailand makes a very good example outside Africa. You cannot do 3 assessments and you fail to get the truth. That is it. Or maybe they do like this. They take away that health immunity from them. You know, even the corporates in Kampala, they only know health insurance because the companies they work for, the NGOs they work for, provide a slot of Are you married? Yes. They tick. If so, how many children do you have? This and this. I have 3. Then the company says, okay, we shall be paying this insurance, health insurance only, but for this percentage.
Yes.
That's why you see them with cards, Jubilee, what? It's not because they even knew about it. It's because the company is telling them, guys, look, you need the health insurance for your children.
So we cover half, and also
Hey, you also cover.
So when we cater for half, also we cover for half. Oh,
But when your child knocks 18 years, we get off.
okay.
But if it wasn't that, you think they would be knowing, people here are dealers. They go with the flow. So I think we need that really.
So, in other words, Uganda should be flexible, and we are not too old to learn. So we can learn. Mr. Aruho, as we wind up, of course, you know that in our norms of MJD Build Africa, you cannot just go without tacking on Pan-Africanism. So, as a leader, what does Pan-Africa?
Sadak, it then gives you a streamline into why were these people pushing for integration?
Yes.
Then now you look at it from the aspect of, let me look at what they wanted to achieve politically.
Yes.
What were their goals? Did they attain them? If not, why didn't they attain them? As a leader currently, what can I do to at least sort of push that agenda?
Yes.
You get it. It gives you a streamline. It gives you a blood flow into. It gives you passion. So that then you know that later on, should I become a public servant or should I be a civil servant? There are things I cannot do. Things such as embezzlement of funds. Because it can lead to, at its maximum, it can lead to a coup d'etat. Now remember, whenever every country undergoes such a d'etat,
Yes.
you're going back. So your country, yes, in international people are saying, oh, now we have a new leader, but you're going back steps behind in terms of development because your country needs to reassess its objectives. Is that where we want to be now? No. We want to move forward. So it gives you a streamline that in my leadership styles, there are things I should do. There are things I should not do. There are areas of advice I should get. But there are also areas of advice that I should have grown up with culturally. I cannot be a thief.
Yes.
I cannot participate in corruption. I cannot participate in any mode of corruption, by the way.
Terrorism.
Corruption, we are not just looking at corruption, embezzlement of funds, no. Corruption goes deep, nepotism, all those things. Terrorism, I cannot participate in that. Treason, I cannot, because people have trusted me with a certain office. Whether you're a guild speaker at university or whether you're a guild president, there are things you should not be doing in your university. You can't be a guild president. And then we are also hearing cases of you sleeping with different girls.
And yet you are the guild president.
Yet you are the guild president. So what example are you setting up for the rest? That's how it was.
But I think most of students maybe think that those are the immunities that you have as guild president. Those are privileges and immunities. Hey.
You should set an example. That Dominic was the head of MJD. In Dominic's tenure, he did A, B, C, and D. Yes, he had failures, but they are not that bad for his name to be put in the mud. That when he was the head of MJD, every girl who used to come used to sleep with them for them to appear on this podcast. No. At least we'll say, okay, he did not have many episodes, but the few he had were quality. He did few, but quality.
So thank you, Mr. Aruho.
You're welcome.
As we wind up, allow me to ask you this as last question. As a current leader, Pan-Africanist, in your prediction, where do you see Africa in 2036? In the 2036 agenda of Africa?
I think we are not going to have already achieved it because we still have those issues disturbing us here and there. Currently, we have that Sudan question that is ongoing. But then we also have the mild Ethiopia question that continues to run, the Tigray.
Yeah, the Tigray issue.
So I think we've not yet reached that.
The same to DRC.
The same to DRC, the same with Madagascar, which is just trying to undergo whatever they're undergoing. So I think 2036 is still near, but there is progression. If you see what Ibrahim Traore is doing, if you see what is it called Dumbuya, what is doing,
yes.
If you see what West African countries are doing currently, I think they're going on the right path.
in Niger,
So if
Senegal,
and Chad,
that line.
Yes, that line. So if we can only follow in on that path, but also if you can see what Rwanda is doing, I think Rwanda is giving, people may call it PR.
African is Singapore.
But you see there is a trajectory they are going to. That if they pick on a certain area, now if you see their sports development, they are moving. They're having partnerships. So Visit Rwanda is known. So I think if we are doing well, but if we can get off those things of blame a game,
Blaming each other.
this one, we shall move.
Thank you, Arho, on your prediction. Then, as we wind up, Arho, 2 words that you can tell our fellow youth who are following us on MJD Build Africa.
Thank you. My fellow youth, I want you to follow MJD Build Africa. The reason is the people that come here have taken off their crazy schedules to appear. That means they have been invited. That means they have taken time to make research. And they're not here to pass time. So I think let's support MJD. Let's be there for them. If it means a retweet, please retweet. If it means a follow, please follow them. It's not just beneficial for you, but it's also beneficial for the person that you may be mentoring, both directly and indirectly. Above all, may you keep healthy and have a dream for Africa. Thank you.
Africa for Africans.